1. Which instructional strategy best supports retention and recall in MoCA language tasks for adult learners with mild cognitive impairment? A. Drill-based rote memorization. B. Repetitive echo reading. C. Contextual storytelling and elaboration. D. Silent independent reading. 2. In a clinical setting, what is the most appropriate method to mentor a colleague on scoring the delayed recall task of the MoCA? A. Sharing the instruction manual only. B. Allowing unsupervised scoring attempts. C. Modeling with patient examples and feedback. D. Relying on online video tutorials. 3. What approach aligns best with adult learning principles when teaching semantic fluency assessment in the MoCA language section? A. Memorizing lists of animal names. B. Group discussions of category cues. C. Isolated vocabulary drills. D. Timed rote rehearsal tasks. 4. When adapting MoCA memory tasks for adult learners with auditory processing disorders, which instructional design should be prioritized? A. Use of visual storyboards. B. Increasing background noise. C. Shortening task instructions. D. Eliminating recall questions. 5. Which of the following best ensures regulatory compliance during administration of the MoCA attention task in a licensed healthcare facility? A. Administering it verbally only. B. Allowing family assistance. C. Following test protocol exactly. D. Using unvalidated task substitutions. 6. An effective formative assessment for MoCA digit span task proficiency would include A. High-stakes written exams. B. Immediate feedback on trials. C. One-time evaluation at session end. D. Grading based on peer observation. 7. In the context of clinical instruction, which teaching method most effectively demonstrates MoCA sentence repetition accuracy? A. Repetition without visual cues. B. Silent demonstration of articulation. C. Real-time modeling with correction. D. Reading from written notes. 8. During curriculum development for cognitive screening training, what is a key learning objective for the MoCA memory section? A. Memorizing scoring guidelines. B. Understanding test item origins. C. Analyzing delayed versus immediate recall. D. Ranking patients by performance. 9. Which element most contributes to test validity in MoCA attention tasks? A. Examiner bias toward patient answers. B. Strict timing and standardized wording. C. Personalized task modifications. D. Reordering tasks for patient comfort. 10. A primary benefit of mentoring new clinicians on the MoCA language section is A. Reducing time per test. B. Enhancing consistency in scoring. C. Improving casual language use. D. Avoiding formal training protocols. 11. What is the most effective way to teach correct verbal instruction delivery for the MoCA attention task? A. Written handout instructions. B. Instructor modeling and repetition. C. Peer-to-peer role-play. D. Self-study through manuals. 12. When evaluating a trainee's MoCA memory instruction competency, which method best supports constructive feedback? A. Delayed written feedback. B. Group grading sessions. C. In-session feedback with modeling. D. Reassigning patients for independent trial. 13. Which MoCA component is most dependent on working memory processes? A. Visuospatial cube drawing. B. Delayed word recall. C. Sentence repetition. D. Clock drawing. 14. For an adult learner with limited literacy, which adjustment helps maintain the integrity of the MoCA language assessment? A. Eliminating the sentence repetition item. B. Substituting drawing tasks for writing. C. Using oral models for support. D. Skipping fluency exercises. 15. Which of the following best describes the goal of the repetition task in the MoCA language section? A. Testing general comprehension. B. Assessing phonological memory. C. Evaluating grammatical processing. D. Measuring short-term auditory recall. 16. A primary instructional goal when teaching MoCA attention task administration is to A. Teach alternatives to digit span. B. Build examiner consistency and pacing. C. Encourage client multitasking. D. Focus on creative scoring flexibility. 17. When developing a workshop on the MoCA, which technique best supports adult learning of the memory tasks? A. Silent demonstrations. B. Repetitive handouts. C. Scenario-based practice. D. Memorization quizzes. 18. An example of ineffective mentoring in MoCA language scoring would be A. Encouraging peer comparison for accuracy. B. Providing concrete examples of acceptable responses. C. Reviewing errors with clarity and patience. D. Modeling fluent sentence delivery. 19. Which technique is best suited to evaluate an adult learner's readiness to administer the MoCA delayed recall test? A. Role-play simulation with rubric-based scoring. B. Multiple choice knowledge test. C. Written reflection on memory theory. D. Open discussion on recall techniques. 20. A training session emphasizing regulatory compliance in MoCA test use must include A. Patient diagnosis interpretation. B. Scoring flexibility based on patient background. C. Proper credentialing and licensing protocols. D. Time-saving shortcuts for scoring. 21. In a clinical workshop, how should a mentor model the MoCA attention test to ensure learner accuracy? A. Use previously recorded patient videos. B. Live demonstration with peer feedback. C. Allow trial and error with real patients. D. Direct learners to observe silent scoring. 22. When adapting MoCA memory training for ESL adult learners, which method is most effective? A. Provide translated MoCA test. B. Focus only on digit span. C. Use clear, slowed verbal instructions with visuals. D. Skip sentence repetition entirely. 23. When scoring the MoCA sentence repetition, which guideline ensures interrogator reliability? A. Accept any reasonable paraphrase. B. Score based on pronunciation only. C. Follow scripted scoring rubric precisely. D. Use intuition and personal discretion. 24. The digit span backward task evaluates which cognitive function? A. Visual recognition. B. Episodic memory. C. Executive attention. D. Semantic association. 25. Which strategy helps prevent scoring bias in MoCA language tasks? A. Relying on examiner memory. B. Using a standardized scoring checklist. C. Adjusting scores for patient culture. D. Allowing for examiner discretion. 26. During mentorship, what is the ideal approach for correcting errors in MoCA memory administration? A. Post-session email notes. B. Public feedback in group settings. C. Real-time gentle correction with rationale. D. Ignoring to avoid discouragement. 27. A critical regulatory requirement when using MoCA in memory clinics is A. Altering tasks based on clinician judgment. B. Documenting administration inconsistencies. C. Obtaining proper MoCA certification for use. D. Averaging scores across cognitive domains. 28. Which method best supports adult learners' understanding of digit span performance analysis? A. Using flowcharts and modeling. B. Memorizing span norms. C. Reading academic research only. D. Avoiding numerical tasks. 29. In evaluating memory recall performance, which task offers the most insight into hippocampal function? A. Sentence repetition. B. Animal fluency. C. Delayed word recall. D. Copying a cube. 30. Which approach is most appropriate when training clinicians on MoCA's attention-switching tasks? A. Paper quizzes on theory. B. Clinical observation without feedback. C. Interactive demonstrations with discussion. D. Delayed solo practice. 31. Which language task most closely evaluates syntactic processing in the MoCA? A. Fluency naming. B. Sentence repetition. C. Word recall. D. Orientation questions. 32. The most effective way to teach clinical reasoning for scoring the MoCA memory section is to A. Assign textbook chapters. B. Share sample responses and rationales. C. Avoid error discussion to reduce bias. D. Have learners generate their own test items. 33. How can supervisors best ensure long-term adherence to MoCA administration protocols? A. Distribute one-time checklists. B. Conduct annual refresher audits. C. Leave protocols up to department heads. D. Eliminate documentation reviews. 34. What feature of adult learning is most important when teaching MoCA language scoring to new nurses? A. Passive absorption of content. B. Social interaction with minimal feedback. C. Immediate application with feedback. D. Use of memorized test scripts only. 35. Which MoCA item most directly assesses divided attention? A. Serial subtraction. B. Delayed word recall. C. Repetition of phrases. D. Clock drawing. 36. What is the most effective strategy to teach sentence repetition scoring to clinical interns using the MoCA? A. Provide them with answer keys only. B. Let them observe senior staff silently. C. Use role play with real-time correction. D. Have them write sentences from memory. 37. Which adult learning technique enhances retention of correct MoCA attention task sequencing? A. Mnemonic memorization. B. Task demonstration and immediate practice. C. Randomized self-quizzing. D. Passive listening to lectures. 38. What is a primary risk when modifying MoCA language tasks for informal settings? A. Decreased rapport with patient. B. Reduced inter-rater agreement. C. Enhanced neuroplasticity. D. More valid test responses. 39. Which assessment activity best helps trainees learn the distinction between working memory and attention in the MoCA? A. Reviewing patient charts. B. Timed quizzes on terminology. C. Performing both digit span tasks and comparing results. D. Writing an essay on memory theories. 40. What component of the MoCA is most sensitive to early-stage Alzheimer's in memory testing? A. Serial subtraction. B. Delayed recall. C. Repetition of sentences. D. Fluency naming. 41. In training sessions, which method should be avoided when teaching proper MoCA language item delivery? A. Reading script word for word. B. Using simulated patients. C. Freely paraphrasing test items. D. Providing examples of acceptable answers. 42. A common error by novices during MoCA attention task scoring is: A. Allowing self-corrections. B. Marking each digit said aloud. C. Failing to administer backward span. D. Skipping repetition instruction. 43. Which instructional design best supports clinicians learning MoCA verbal fluency scoring? A. Watching a video of test delivery only. B. Reading fluency theory papers. C. Practicing with multiple real-time samples. D. Memorizing scoring rubric without application. 44. A supervisor ensuring compliance with official MoCA use would emphasize: A. Translation flexibility. B. Standardized format and administration. C. Cultural personalization of scoring. D. Local institutional interpretation. 45. Which learning method is most suitable for teaching time-efficient MoCA administration? A. Step-by-step guided simulations. B. Timed written exams. C. Watching time-lapse case studies. D. Assigning textbook reading. 46. To enhance accuracy in MoCA memory scoring, mentors should prioritize: A. Feedback on word pronunciation. B. Correction of delayed recall criteria. C. Avoiding distractions during naming tasks. D. Memorization of testing rules. 47. Which statement best reflects the purpose of MoCA digit span backward? A. To measure abstract reasoning. B. To assess selective attention. C. To evaluate auditory working memory. D. To test episodic recall. 48. In adult education workshops on MoCA, how can instructors address varied prior experience levels? A. Assume a basic understanding of memory systems. B. Use one standard lecture format. C. Include tiered practice scenarios and feedback. D. Avoid open discussion to save time. 49. What method provides the strongest evidence of mastery in MoCA attention task delivery? A. Written protocol test. B. Verbal description of task steps. C. Live performance under observation. D. Multiple choice comprehension quiz. 50. What is the main goal of the verbal fluency task in the MoCA? A. Evaluate long-term memory. B. Assess expressive language and executive function. C. Test comprehension accuracy. D. Rate articulation and accent. 51. When preparing clinicians for MoCA test use with diverse populations, it is important to A. Adjust scoring for regional dialects. B. Use translated versions without certification. C. Teach cultural sensitivity without altering protocol. D. Eliminate nonverbal tasks. 52. A suitable mentoring strategy to ensure MoCA compliance is A. Allowing each clinician to modify instructions. B. Setting individual score thresholds. C. Conducting periodic peer review sessions. D. Letting clinicians design their own tasks. 53. Which feature of MoCA sentence repetition helps identify subtle cognitive decline? A. Mispronunciation. B. Grammatical complexity. C. Sentence length. D. Fluency of delivery. 54. When developing evaluation tools for MoCA memory task training, include A. Unstructured interviews. B. Closed book scoring drills. C. Group recall competitions. D. Peer observation checklists. 55. Which method best enhances long-term retention of correct MoCA administration procedures? A. Repetition without feedback. B. Randomized skill drills. C. Immediate application with instructor feedback. D. Memorizing instruction scripts. 56. How should instructors manage common errors in verbal fluency task delivery? A. Ignore them during training to reduce anxiety. B. Provide immediate modeling and correction. C. Offer delayed group reviews. D. Assign self-paced online modules. 57. Which task requires the most executive function in the MoCA? A. Copying a cube. B. Sentence repetition. C. Fluency generation. D. Word recall. 58. A trainee scoring a delayed recall response as correct despite queuing has violated A. Curriculum standards. B. Learning theory. C. Standardized scoring criteria. D. Adult learning principles. 59. In teaching clinical application of MoCA memory sections, the best strategy is to A. Present theory-only lessons. B. Practice items out of context. C. Simulate real case studies. D. Focus on rapid test administration. 60. Which of the following violates MoCA ethical guidelines? A. Using unlicensed test materials. B. Providing supportive recall cues. C. Skipping required tasks. D. All of the above. 61. What instructional method supports adult clinicians struggling with scoring language repetition? A. Immediate correction using visual cues. B. Pausing training for independent reading. C. Group scoring debates. D. Encouraging improvisation. 62. In regulatory training sessions, which item is most emphasized regarding MoCA use? A. Cross-cultural scoring. B. Rewriting tasks for clarity. C. License certification for administration. D. Memorization of patient results. 63. The most effective way to develop clinician proficiency in MoCA's attention tasks is A. Lecture on neuroanatomy. B. Memorization of scoring protocol. C. Repetitive modeling and guided practice. D. Use of self-guided modules only. 64. A mentor should demonstrate MoCA fluency task administration by A. Explaining semantic field theory. B. Performing the task in real time with standard timing. C. Reviewing cultural categories. D. Discussing alternate assessment methods. 65. Which task within the MoCA best tests sustained attention? A. Backward digit span. B. Sentence repetition. C. Fluency naming. D. Serial subtraction. 66. To ensure competency in MoCA memory scoring, training must include A. Legal documentation standards. B. Case-based scoring exercises. C. Deep dive into cortical regions. D. Time-saving techniques. 67. How can instructors evaluate training success in MoCA language task performance? A. Oral question and answer sessions. B. Anonymous surveys. C. Practical demonstrations with checklists. D. Written multiple choice tests only. 68. A best practice for ensuring test fidelity during MoCA attention task is A. Strict use of alternate forms. B. Flexibility with digit ranges. C. Adherence to scripted prompts. D. Examiner-generated numbers. 69. For ESL adult learners, teaching MoCA sentence repetition may benefit from A. Language scaffolding before testing. B. Translation of sentences. C. Simplifying test content. D. Use of written scripts. MoCA language, memory and attention test. The MoCA language, memory and attention test is a key component of the Montreal Cognitive Assessment MoCA, a widely used screening tool designed to detect mild cognitive impairment and early signs of dementia. The language domain evaluates expressive and receptive abilities through tasks such as sentence repetition and verbal fluency. The memory component tests both immediate and delayed recall of word lists to assess encoding, storage, and retrieval processes. The attention domain measures sustained and working attention using tasks like digit span, serial subtraction, and vigilance. Together, these sections provide critical insights into an individual's cognitive function, making the test highly valuable in clinical, academic, and research settings. Here are the top 5 beneficial uses of the sample exam. 1. Early detection of cognitive impairment. The MoCA language, memory and attention test helps clinicians identify subtle signs of cognitive decline, such as mild memory lapses, attention deficits, or language disruptions, which are often early indicators of Alzheimer's disease or other dementias. 2. Baseline and progress monitoring. The test provides a structured framework to assess baseline cognitive function and track changes over time. allowing healthcare professionals to measure disease progression or the effectiveness of interventions. 3. Comprehensive cognitive screening. By integrating memory, language, and attention into one tool, MoCA offers a holistic view of cognitive health, supporting differential diagnoses and personalized care plans. 4. Training and evaluation of clinical competency. The MoCA test is used in educational settings to train and assess healthcare professionals in cognitive assessment procedures, scoring accuracy, and interpretation. 5. Supports research and policy development. It plays a key role in research studies and public health programs by providing standardized cognitive data that guide policy and resource allocation.